Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to some serious orthodontic students today. And the thing that I will show you, for those who are just starting, just flip on over to something a lot more simple than this particular case. When I first treated it, I did not fully understand every aspect of this, and I thought that it was impossible to do this non-surgically. Later on, I have come to the conclusion that it possibly could have been done without surgery and done it fully. So I'm going to go through this, and it's a serious orthodontic case, and if you're just thumbing through and doing some simple stuff, don't even waste your time here. But it is a good case to follow, and if you want to learn a lot about it, study this case thoroughly. So let's get started here with it. I'll have to go over here, I think, and get my little point going. Now this is a real tough class 3 case. This young man has a lower jaw that's way out in front here, and there's way too much vertical height of the face in this area, and it could have been done better, but I would have sent him to surgery back when we were treating this. I didn't think that we could possibly do it non-surgically, but now I believe that we could. And so this is going to be hard to understand for a lot of folks. So anyway, this is good. If you really want to learn orthodontics, this has a lot of stuff in it to learn. Let's look at him from the front. The same thing, a nice looking guy, but he's got about that much too much vertical height of the facial structure. You'd like to balance it out like that, and you'd probably take it off right in here, and we could go back and do a genioplasty on him. You could have helped it, but he didn't want to get into all this, so I said I'll do the best I can. And at the time I did it, I did whatever I knew how to do to help this young man, and we did a pretty good case as far as treating the case and getting it treated. Now when he smiles, if he smiles big, you don't notice the excess vertical height of it, so he could do that. Now we've got a class 3 case where the tongue is pushing forward on this, and it's got it way out here. Now people, if you're doing surgery, they would do a upper surgery and bring it forward and then reduce the size of the lower arch too. And we're going to do this, but I believe you can do a double jaw correction here without doing the surgery. And that's where it's going to come in, where some people would think that's not possible, but I think it is possible, and I'm going to try to show you that during this case, the way we treat it here. So it is a serious class 3 case. You see this point of this cuspid should be down in this groove here, just about the distance that these teeth are out in front down here. The tongue is pushing on this pretty hard. This is the 6-year molar. It's way out in front, and it's really, this is going to go back, and we're going to come in and extract, or send him to get these teeth extracted, and we're going to do the case And hopefully we'll bring these teeth up close to this right here, but we're going to pull these back while we bring these up. And if we were doing it today, I'd put a pin in here and bond these teeth and pull on them hard and bring these teeth further forward. And the way you do that, but wear some class 3 elastics over here, and then pull these teeth back. It wouldn't pull these back. They would be stuck by the pin, but they'd bring all the teeth forward. It'd be like doing a double jaw surgery here. So let's get on, and I'll show you this a little more complicated. And if you're just messing around with orthodontics, don't even think about doing this case like this. Now on this side, the cuspid was back, let's see, over here it was back that far. And on the other side of the mouth, it was back about half that much. But so the midline would be off some. And see, this is the center of the midline, and you're going to have to pull this less over here and bring this back on that side to line the teeth up just. So that's not a real complicated thing to do. Now here the upper arch is kind of tilted off to that side that's off, and so you want to straighten this out. And you see this bicuspid is back further than this one. This is tilted over in this direction right here. Now the 6-year molars up above are fine, but you look on the bottom and we've got a tremendous bad 6-year molar here and one with a filling on this side, and we have a 2nd and 3rd molar. You couldn't do this without them. So we're going to send them in and get these 2 teeth extracted right here. And I'll go through the x-rays with it, and there's a really good difference in the amount of crowding over on this side and the amount here too. And these teeth are sucked in a little bit, so we're going to round this bottom arch out as we pull those teeth forward. Now here we are going ahead and start, let me see, we started this case in 10 of 91. I said just a little bit in 91. Most of it starts in 92. So here's 3 of 92. And back then, I thought, well, if I'm going to jump this bite over here, I'll have to put the block right out here in front. And this was the mistake. I shouldn't have put the block there. I should have put the block back in the back part of the mouth after these teeth were extracted or before they were extracted, and start working on this with the case teeth right after they're extracted, which we did. But put an intruding arch here and bring these teeth down with an intruding arch, and you can wear blocks back here. Now, when you put the block up in front here, you force the guy to chew here, and there's nothing touching back in there. Let me show that again. He's biting down here, and nothing is touching back here. Now, whatever these teeth move together while you're bringing this down or jumping it over, you're going to increase this vertical height of the face in here. See, as they move together. So if you're done it with a blocks back here, you could keep these teeth, you would depress these teeth back here while you were able to lower these and jump the bite that way, and that would have lowered the face a considerable amount. And so anyway, that was a mistake that I made, but it was the best I knew at that time. And so nobody else knew it either. So and he was not going to do surgery, I would have sent him to a surgeon and let him do this case. But here we are in 92, and we're going to widen this out, and we're bringing these teeth out. And there's this block. As we chew on this and nothing touches back here, these teeth move together, and that increases the vertical height of the face to some extent. But we didn't take very long bringing these teeth back under. We were pulling these teeth back as we were pulling the upper teeth forward in doing the case. And we've got a lot of space to cover there. And you start this immediately when you take the teeth out. Start bringing these teeth forward with that. And if you wanted this not to move, you put a pin into the area right here and bond it to the teeth, and then you pull all this forward, and that brings the upper teeth forward and leaves these out and gives you more room for the tongue. The tongue is the main culprit in causing this class 3 thing to happen here. And that would change. Now, we've got I think this is kind of messed up over here, the picture. These teeth are broadened out, and we're pulling the upper teeth forward by pulling the back teeth. In other words, we pull back on the lower anteriors and make the upper anteriors go forward. And so we have corrected that. Whatever time it took us, here it is 1992, 11 of 92, and we've got that corrected. In other words, these teeth were out in front about 3 or 4 millimeters, and we've got them back now and looking pretty good. We got the midline going and everything, and we've closed a good bit of the space in this. But we could have, if we'd had intruding arches here and blocks back here, we would have been able to do the same thing without increasing this vertical height of the face, see? And that's where we made a mistake. But back in 92, I didn't understand that fully, and I don't think anybody else did either. If I had sent him to surgery, he would have gone through an extended surgical procedure. And I think now that I could have treated this case and got the vertical height down a good bit without doing that. But these teeth they're coming, these teeth we're pulling, from the front back like this, trying to bring these back, and when we will bring this out to the front, that helps get the tongue more space in the upper arch, but not as full as you could have if you would have put a pin in this area here. Now this space, we have corrected this out here, and we brought these teeth forward, and I'm going to show you this on x-ray here in just a few minutes. All right, we've got the guy corrected a great deal, but really we needed these teeth further out here on the upper to give him plenty of room for his tongue. But it's out pretty good, and we've lowered actually didn't raise the vertical hardly any, even though we had the block in the front. Now I've got some pretty bad photography here, and that was not too good. But here we are out front, and it's 93 now, and this young man is about 20 years old, so he's through growing as far as we can tell, and he did not grow any further than that. Now we brought the molars up this far, and we're going to have to, you pull this arch down this way, and that brings the roots up with the crown as you close the space. Same thing over here on this side is 93 of 93 now, and we've got the upper arch kind of expanded out, you see. Now it's 2 of 93 on this, the lower arch, and we've got this far along here, and we're bringing these teeth bodily forward to match up with the lower teeth here. So here was the start when we started in 91. And you can't see this too good, but these lower teeth were out about 4 millimeters in front of the upper teeth. You don't pick it up on that, but you can see. Now in 94, we've got him underneath here, and everything's done, and he's back a good bit, but I would like to have brought all this further out right there. And we could have done that if we'd have put a pin in this, and then we would have pulled these back teeth forward, but we wouldn't have moved this at all and brought the upper teeth, we would have brought them out some. We've been wearing elastics. I'm sorry, the elastic would go this way, right here. And we would have kept this here, and it would have pulled this further forward, and we would have lowered this vertical. Now, once you're out here, and you finish here, if you want to come in and do a genioplasty, you can take a piece of the tissue out here and bring the chin up about that far, and it would look a lot better, but he had no desire to do that at all, and so we left it like it was. Okay, here we're starting. This is 10 of 91, and this tooth here is in bad shape, and he's got a good wisdom tooth back here. You couldn't have done this, so we're going to take out these molars right in here, and we're going to bring these forward bodily, and so your arch wire, you come in here and you go down with it, bring it up, and as you close it, the roots will go with the crown up here. And then this tooth here, you could have gotten rid of it if you wanted to. So we're pulling these teeth in front back, but if you put a pin right down in here, these teeth wouldn't have moved back much, and we would have moved everything up here forward quite a bit, and that would have helped the appearance of it. And we had to use the intruding arch to lower this down, so we had to put the blocks back in this area of the mouth, and you could have pulled on them and they wouldn't have moved at all, and we could have done this. It's like doing a double jaw surgery in here, and if you've ever scrubbed in with a double jaw surgery, you'd be willing to do it if it was this. Now, probably the oral surgeons wouldn't like this at all. It would take away, but it would take you a while to do the case. And so this guy's like, his age now is 23 and 4, and it's 92, and then we moved this out, and they brought these teeth forward in here, and we'll close that space completely. Now it's 93, and he's 24 years old in 2 months. Now he's 25 years old, and we've got this together now. And if there's anything short, we're tending to crowd the lower tongue more, the tongue more. If we'd have put pins in here and held this, you see these teeth are leaning back a little bit. But this is 94, and we finished up, and that's the point we got to. There it is, it's 4 of 94, and now here's some pictures, and they aren't the best pictures, but we'll go through them pretty quick. 93, there's class 1. We'll go ahead and we'll bring this up to there. So this is, we continued doing this where we're actually pulling this back and bringing this forward down here more. We've got him just about there. And that's class 1. Now the midline is on the center, and this is 4 of 94. And we're going to finish him up here. All right, this is, we still had some brackets down here. We bonded a seal on this. And this is 10 of 94. We're finished with the case. And we took those brackets off and we bonded the deal on the back side back here. We still had these brackets on there when we did that. And you could have worn this retainer for class 3s in there. So these are second molars, and these are wisdom teeth. Second molar and a wisdom tooth back there. And now we'll have to watch this tongue. If we brought this back, you have to use this retention for class 3 cases, which is another case if you want to look into that. So this is a serious case that could have probably been done without surgery and gone in. If we had put the bond blocks back here, it would have kept them open to bite more, and you could have opened and jumped this by putting blocks back here. That would have closed this down better and wouldn't have quite the height that we had in it there. So here is the case. When we got through, at least the chin was sticking out here. We got it back in. We should have, if we could have got a little more growth of the upper anterior, see, by blocking this off and wearing class 3 elastics down here, we've been pulling this forward and pulling this back, but this wouldn't move much, and bring it close this, the teeth from the back end there would have come out with a little better profile. So here it is, and he's got too much vertical height in the face, but if he smiled like that, you hide that, and a young man can get by without this. So there's a lot to learn on this case. If you're really serious about treating class 3 cases non-surgically, you could do this case better. And then if he would do a little genioplasty right in here, we would reduce the height of the chin, and you'd have him just about where you wanted it here. Thank you for watching, and I think there's some pretty bad pictures here, but that's the finished up there, and now we're in a class 1 relation on this side. Over here the light is terrible, but we've got him, and he's like 20, this is 12 of 24, and this is almost finished in here. We got a little space down on the bottom there, but these are second molars and wisdom teeth back here, and we've done away with that, and we've corrected the class 2 problem. So that's the end of it. I thank you for watching, and if you're a serious orthodontic student, study this case. There's a lot to learn about it here. And so I want to say goodbye, and I'll hope to see you again. And I want to stop the case, and I hope you'll join our group and subscribe to it. And thank you for watching.